Pineal Stories is intended for information and educational purposes only. The content shared on this podcast should not be taken as medical advice. We aim to raise awareness and foster thoughtful discussion around symptomatic pineal cysts. We are not providing medical guidance or diagnosis. Always consult a qualified healthcare professional regarding any medical concerns or decisions. Every individual situation is unique, and only your doctor can help you determine the best course of action for your health.
Hey everybody, thanks so much for joining us again. We're very, very excited this week because we have Dr. Patel and Jared Nix. A couple of names that you've heard a few hundred times on this podcast so far. And we're just thrilled that we're able to get this together and to have them. And in fact, you will be hearing this well in advance of some of the others we've recorded, and that's by popular request. Everybody wants to hear this one as soon as possible, so it's going to get bumped up the list, so it's a little bit out of order.
Dr. Patel is board certified in neurological surgery with additional fellowship training in skull base surgery, cerebral vascular surgery, and micro neurosurgery. He's been in practice for well over 20 years and is currently the chair of neurosurgery at Medical University of South Carolina. He's here with Jared Nix, the PA who does the intake initially for a lot of patients, including Kelly, and does the follow-up, and we are huge Jared Nix fans. He is sort of the doorway into this whole thing for most folks, and certainly for us. I just want to start with Dr. Patel. What led you to take an interest in pineal cysts, and what made you think that maybe this causes symptoms?
Pineal cysts or cystic enlargement of the pineal glands been known for forever since I was in training in neurosurgery about 30, 40 years ago. And most of the time, the majority of the time, these patients did not have symptoms. And that's true knowledge for all neurosurgeons, neurologists, and neuroradiologists. However, maybe about 15, 18 years ago, every time I say that, a year has gone by. So somewhere around about within 2 decades ago, I started to see patients with some common symptoms that did not have any other reason to explain it. These are mostly women, a few men, and nothing else wrong with them. They didn't hurt their head. They're not on any drugs. There's no bad boyfriends or husbands or so psychosocial going on, and the common symptoms of headaches and difficulty sleeping or cognitive issues, and a very functional human starts going downhill. And you dig into it as much as a neurosurgeon would dig into it. A lot of these patients, for their headaches, had neurologists try to treat them, and the headaches don't go away. They don't have a strong family history of headaches, et cetera, et cetera, et cetera. So I sort of shelve these patients. I have a habit of just kind of tucking them in when I say shelf, I mean, put them in my mind that I saw that one, et cetera. I tend to talk to a few neurosurgeons around the world. We often meet, and I say, hey guys, have you all seen symptomatic pineal cyst patients? And most of them said, no, those are benign. But 1 or 2 surgeons came and said, I removed it and my patient had a remarkable recovery. And so I said, okay. Now, typically when a cyst or a mass causes symptoms in the brain, it's because of the mass effect, as we call it. But that was not true in these patients. They had relatively small cysts. There's no pressure. The gland is in an empty spinal fluid space we call the trigeminal cistern. And it's very soft, it's not like a hard mass pushing on the brain. Anyhow, the best story is of the first patient I did this on. She was a lady, a pharmacist with 2 kids and a husband, happy family. She was working hard. And over the prior 2 years, she was declining and nothing else wrong on her MRI scan. And she came to Charleston from California because her sister lives here, and I've been here nearly 30 years practicing, and knew of me and said, why don't you come have Patel see you? So by then I'd had my conversation with the 1 or 2 surgeons who did this surgery. And I told her, look, I'm skeptic. I know how to get into this spot. It's right in the middle of your brain, but there are nice, intricate ways to get into it without hurting the brain. I'll take it out, but I don't believe you'll get better. I have never done a case like this, but I did it. She pushed me to get it done. Pushed meaning, she had no other choice. She had quit her job. She couldn't mother her kids. She couldn't be a good housewife. She couldn't do anything. So I did it. And 10 days later, when I walked into the exam room, she ran from the chair in the room to me and hugged me. It takes that first case. And then, of course, I saw the next and the next and the next. And so what I've learned to date is that this is a hormonal gland. The pineal gland is a gland. We call it a gland because it's hormonal, but in humans, it's supposed to be vestigial. It's supposed to have no function. Why the gland enlarges, why in some patients with enlarged gland, it produces stuff, which I think hypothetically is producing stuff that wreaks havoc with the brain, and causes symptoms. I don't know the answers to that. All I know now is, and Jared may correct me, um, we've done nearly 300 or more than 300 cases. And the story is always the same. Healthy young people who are doing fine. There's no trauma. There's no exposure to any drugs that we know of or anything like that going on. And they have these common symptoms of headache, cognitive issues, and we take them out. And, I've become good at it. I've got a good team of people. So anyhow, that's the story in the pineal. More needs to be done. We need to really figure out what caused this cystic enlargement, number one. Number two, why is it in some people it's starting to produce, and what is it producing? So that's all pending research, which the NIH is shut down right now for reasons we all know. Cut down on research, but even before it's considered rare. So, but we have a good scientific plan on what to do with the tissue we've gotten, and hopefully we'll reach some answers soon. But I tell you what, to see 90% of patients come back, and Jared can tell you more and say, everything's better, and the remaining 10% say, I'm glad I had it done, but this one thing or that another thing is not better. This is brain surgery. This is not, clipping your toenails, um, which can be sometimes risky, but not totally a benign decision to make. And so, anyway, Jared, you can say more if you want to.
Please.
Okay. Well, Michael, you've got a perfect voice for this. I grew up around radio and sounds fantastic. So you're in the right place.
I used to do
Um,
that.
okay. Well, I appreciate you having us. It's been a real honor of my career to be able to work with Dr. Patel and with pineal cyst patients. Um, I think for me, I still remember the first day I was helping with one of Dr. Patel's post-op patients. And this was many years ago. His nurse practitioner was out of town or something, and I walk in the room, and it's about 3-4 days after brain surgery, and the family gives me a hug. I've never met them. I wasn't involved in their care in the hospital, and they gave me a hug. And the family could tell a difference the moment the patient woke up from surgery. They're groggy, they've been through a lot, but there was in this patient, there was a sense of humor that had been lost, and only the people that love them would pick that up, I think, quickly. And that meant so much to me because I thought, wow, I mean, that's when this person's going to feel the worst. They've been through so much, and they've got medicine in their system, and how can you possibly see that? And I found that that was consistent, that loved ones see these changes very quickly. And it's real important for them to reassure the patient, because the patient goes through lots of ups and downs. They'll have pain, they'll trouble sleeping early on, so there's a lot of things we expect the family isn't experiencing. But yeah, it was truly amazing to me. I trained out of state, and we were always trained that pineal cysts weren't symptomatic. Couldn't say why. It was just one of those unspoken or spoken things in neurosurgery where it is what it is. And um, the day I met that patient and their family, it really changed a lot for me because I realized how much I don't know, and how intuitive the family and the patients are in these cases. Because by the time they find us, they've been through a lot.
Mhm.
Yeah. So.
One of the people we interviewed for this podcast was our son. But he's 14 years old, and his perspective was surprising. We live in the same house. We talk a lot. We know each other pretty well. And we were surprised by his perspective because it gave him the opportunity to just open up and talk about it. And the first thing he said, and after Kelly got back from recovery and she's in her room and he finally gets to go in, as a 12-year-old at the time, was, I got my mom back.
Yeah.
He knew right then.
I felt a difference immediately, and I have to thank Dr. Patel and Jared literally for giving my life back because
Absolutely.
I was just like that first patient you talked about. Yeah, my son noticed immediately.
Yeah, and so I hope some of the doctors who were opposed to this will listen to that one specifically because a kid's perspective on this was something. Okay, so speaking of those doctors, you so you have your conferences, you go, you ask, no, that doesn't cause anything. Well, maybe it does. You do the surgery, you find out that this person's better, you get the big hug. So you're moving along on the patient side. How do those doctors react to you after that when you tell them these results?
I think there's still a lot of skepticism, and the reason is doctors are very scientifically minded people, and what we are dealing with is very subjective symptoms, right? You tell me Kelly's upside down, but it's still subjective, right? There's no blood test that I have. There's no um, objective measure of how much pain she has. Is objective meaning measurable, right?
Right.
Measurable ways to say how much insomnia she had or how much psychotic or other psychological symptoms she had. So those things are not being done right now. Perhaps what needs to be done, and we are doing it. You know, I'm not the only one doing this surgery, but if you look in the literature, published literature, peer-reviewed journals, there are few surgeons around the world that have published on this. It is a very difficult surgery. This is not easy. The pineal gland sits square in the middle of the entire head. Not many people want to do surgery there. Not all neurosurgeons are trained or experienced doing surgery there. And it is, if you poll 100 neurosurgeons today, they'll say that this is a very dangerous operation because there's a lot of important critical things in that area. So I think we need to work on more explanations, and that's going to need some research, right? We need to take this tissue that we've stored. I think we stored Kelly's, I can't remember.
You did.
But I've stored over 200 samples to where now the lab that's poised to do the research just needs the funding to look at the mRNA sequencing of the tissue. What is it producing? And then we need to get normal gland, hard to get. We have a brain bank here, and we have a transplant service where folks donate their organs, and so it's a matter of extracting the normal pineal and then looking at the difference in what is the chemical difference to be able to try to understand it, and then come back to the clinic. And when patients like this come, measure those things, whether it's in the spinal fluid or in the blood, and say, all right, now we're seeing some objective data and information to where, so new things in medicine don't happen overnight, right? So we sat on high blood pressure for 250 years, ever since we know people have. In fact, let me give you an example. High blood pressure has been called essential hypertension. Did you ever wonder why it was called essential?
Yes.
The word essential meant, and it was coined in Britain, that it's necessary.
Huh.
Until 200 years later, we realized, oh, wait a second now, it's correlated with heart attacks and brain strokes and kidney failure. It can't be essential. It is abnormal. high blood pressure, right? Diabetes, the same thing. We knew people who were pissing all over the night, you know, because their sugars were high and they're urinating quite a bit. Diabetes mellitus. Mellitus means sweet, right? So you're peeing sweet water, right? And nobody thought much of that for hundreds of years, and then and then we realized, wow, that is an illness. So this is something like that. It's more rare than high blood pressure and more rare than diabetes, but this is exactly like that. You know, it's a condition where, and the difficulty here also is that there are a lot of people that have enlarged cystic enlargement of the pineal gland. They're doing fine. They're just, they look up my name when the radiology report says pineal cyst, they'll Google it. They'll question Dr. Google, who, by the way, doesn't have a degree. And 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 then they'll call me and they come in and say, well, yeah, you have a pineal cyst, but what are your symptoms? None. I just want to know, am I going to live? I said, yeah, of course you're going to live. You're going to live fine. If you have these symptoms, come back to me. So the majority of patients don't have symptoms. So I think Jared and I happen to have the experience of a lot of patients because I happen to treat it. And word gets out that I treat it and I remove these glands. But, you know, I'm also very disturbed by the fact that I don't understand why the gland is behaving this way. You know, for example, we have about now 7 or 8 ladies who were trying to get pregnant. They had a symptomatic pineal cyst, couldn't get pregnant. And then you take the gland out and a year or two later, they're pregnant.
Huh.
Interesting. That is
So,
interesting.
so this is a hormonal gland. You know, currently, if you asked any medical student, you said, what's the master endocrine organ in the body? They'll say the pituitary gland. But was this pineal gland the original master gland that shriveled or died or became vestigial, not important in humans as humans evolved? And then suddenly it enlarged and started producing stuff it wasn't supposed to, and suppressing pituitary function or suppressing adrenal function or suppressing, we've saved patients with thyroid issues. They come in with a thyroid problem before the surgery, and after surgery, they go back to the endocrinologist and the thyroid issues have resolved. Now, it leaves me unsettled because I'm an academic and I want to know what is it doing, right?
Mm-hmm.
There are many more unanswered questions while we're making people like Kelly happy and their families happy removing it. I cannot rest, not a night of rest, until we figure out what is the pathology, what is the pathophysiology of this. Because wouldn't be a dream come true if Kelly came to a neurosurgeon 50 years from now, or 20 years, hopefully 10 years from now, had a symptomatic cyst, and we do a little blood test, response, oh, you've got this overly produced hormone that's coming from a pineal, and we'll just give you this pill, just take it for 10 days, come back to see Jared of the future, and you're fixed. That's the dream.
Absolutely.
Yes.
Yeah, absolutely. So, in identifying these patients, what is it that doctors, in your opinion, should be doing for like diagnostic workups of patients with this cluster? I guess first, how do they best learn what these symptoms likely mean? And then what is it that you would encourage them to do once they suspect it?
Yeah, I think when the patient comes in with constant unexplained headaches, first of all, right?
Okay.
They were fine until about 3 years ago, no headaches, nothing terrible, no drug, and then they suddenly start having headaches. There's no trouble at work, there's no trouble at home. They have no trauma and they have these unexplained headaches. And then after that, it would be cognitive issues, right? The 35-year-old comes in and says, I'm being forgetful, I can't focus, I can't do work, I forget how to get home. A 35-year-old not supposed to do that. Maybe I am, but you know, but quite automated, and they lose their automatic thoughts. They can't make soup anymore. They can't make a sandwich anymore. So cognitive issues before their time. The other thing is sleep issues, and not everybody has them, but the majority of them will declare ultimately that they have sleep issues. So these are the three main things. It's the headaches, unexplained by anything else in the brain, or anything outside or environmental or drug or medication related. Cognitive issues, those are quite common in a lot of patients. Some of them don't have them, but most of them have them. And then the sleep issues, where they find it difficult to go to sleep, or go to sleep and have a horrible sleep pattern to where they're fatigued the next day. And then you look at their medication list. I look at, well, did you see a neurologist? Make sure there's not some sort of classic migraine, and they've tried a variety of medications there. I think that's about it. And then you look at the brain MRI, and no other abnormality. There's no tumor there, but there's this enlarged pineal cyst. I tell you what, it's about as simple as that right now for me, and I would say for all. But still a lot of skepticism, because it's well ingrained in the neurosurgical education that this cannot give symptoms. This is the most serious operation you can do on anybody, right? And it will take time. And of course, we need to do the research in the lab, which once we get the funding, we'll be able to analyze the tissue and be able to do some more diagnostic tests, right? So the next patient that comes in with a pineal cyst with or without symptoms, once we know what are the chemicals, we'll get some spinal fluid and say, oh, yeah, you don't have those chemicals, but the symptomatic one has it. And more science will need to get done. You have to remember one thing. Pineal cysts don't kill anybody. It's not a cancer. It's a functional disorder. And some of the skeptics will say, well, it's a placebo effect. But I said, well, 90% wouldn't declare a placebo effect unless Kelly's pulling one over me and you and everybody else.
Right.
I fail to believe. And Jared, what do you think about placebo effect? Is it?
I think if there were anything to it, it would hold up for 3 months, and what it doesn't speak to is the people whose lives have been changed consistently. You know, it's I don't think it's placebo at all. And to go to your kind of your last question, Michael, about how do we how do we handle this with peers and other people in medicine? I always, when we have a good outcome, which we usually do, which makes me happy, but when we have a good outcome, people a lot of times will be upset at their other doctors who had seen them and say, well, they dismissed me and y'all were the only ones that listened. And I don't think that's true. I think everybody's working with the information they have and their experience and everything. So what I don't want patients to do is to go into their prior neurosurgeon's office and say, aha, you were wrong. That's not that's not going to help anybody. What I do want them to do is just say, you don't have to make an appointment. Just reach out to them. Just say, look, I appreciate the time you spent with me. I wanted to let you know I'm doing really well. And I'm here if you have any questions. And just plant that seed. Don't go in and tell somebody they're wrong who I believe are doing their best. Um, so I think that will change things slowly. And I've seen that. I've seen neurologists, there's folks, I've got a neurologist down in Florida who we've taken care of a few patients and we're seeing more now. So it's a powerful thing, just that firsthand experience that a patient can give their provider, be it family medicine, what have you. And then to your last question of what do we look for, in terms of workup when a patient comes in, that's a lot of what I do is when I first meet people, I want to know, okay, have we ruled out all the other possibilities? So in the absence of something objective for the pineal cyst, what else can we test for? Because my, great fear is somebody has migraines and they rush into surgery.
Right.
Right.
So a lot of times I run interference and it can be frustrating for people, especially they come out of state, they come ready, they've got their binder and they're just,
Mhm.
here's my cyst, when can I take it out? And I say, go get a sleep study, and it's just crushing to them. But for me, I try to look at what are the primary complaints. If it's headaches, see a headache specialist. If it's sleep, get a sleep study, rule out those things, because our pineal cyst patients don't have explanations otherwise. They have normal tests coming back. If they have blurry vision, go
Mhm.
see an ophthalmologist. And those tests are coming back normal. And so that's what I look for when people come in as a new patient that, we're making the decision, should they go forward with surgery, is I just want to see that, I'm not an expert in headaches or sleep, so I need to know they've talked to somebody who is. And if they have no answers and they've got a cyst, well, even more supportive of that. So
Okay. I would say that maybe don't listen to the episode that actually dropped today, because there was a patient who kind of did a mic drop thing with her former neurosurgeon. But she was also very supportive and kind,
yeah.
and is sending him the research that has been published by Dr. Patel. And so she did come around a little bit, but well, anyway, that happened.
Well,
So she
I
earned it.
have to say, as a neurosurgeon practicing for 30, 40 years, I don't know everything. I really don't. Uh, I will not gaslight a patient when I don't know or don't understand their symptoms. And to the best of my experience and knowledge, I look at their images or examine them, and I'll tell them, look, I don't know how to treat you. It doesn't mean you're crazy. This is real. Let me try to figure it out, or let's get another opinion.
Mhm.
No,
Mhm.
because there are two things a physician or a care provider can do when they do not figure it out. One is to do the thing that patients would love, right? Oh my gosh, you're suffering. Oh, this is not good. But I really don't know what's causing it. I don't know much about the pineal cyst. I know typically they're asymptomatic. Or the other thing is to say, nothing wrong with you, get out of here, and all the language that follows, right? Maybe you
Right.
need to go see a shrink or something like that, and 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 you can even do that, but you got to do it carefully. Can we look at the psychological state and make sure nothing is going on there?
Mhm.
Mhm.
But it it is a tough thing. Trust me, I had 26 patients last week, and there were at least one or two that were really suffering. I just couldn't sort it out. That's one you spend the most time on, right?
Mhm.
The easy ones, you say, I know what you got. You got this, this, this. We'll take care of, hey, Jared, let's just set them up for this, that, to the other, whatever, right?
Mhm.
But the ones you don't understand, you just have to spend a little more time on them with the hand on their shoulder and say, gosh, you are suffering. I'm sorry about that. We don't know everything. I've learned this interesting sentence over the past 2 years. That, you know what? I've realized I don't know everything. I don't. I mean, the more experience I get, the more I've realized that I can't understand everything. I just don't. And so the poor patient comes to you with their body and say, hey, doctor, I hand you my body. Can you fix it? And you open the hood and you look in there and say, gosh, I don't see anything. You put it down and you say, gosh, I wish I could help. There's Dr. Smith next door. Maybe you ought to see him. Maybe, it takes a lot of brains to figure it out, not one brain. You know, it,
Yeah,
you know, we have a very complex body.
absolutely. Um, okay. Speaking of complexities, are there systemic or what am I trying to legal? Are there legal pressures that sort of discourage doctors from acknowledging this, in your opinion?
I I don't think it does if you keep an honest conversation with the patient. Legal things happen when you don't honestly express to the patient, right? For example, this is a serious surgery. Using words like, I can definitely cure you, you'll 100% get better, those are wrong, right? You say,
Mhm.
look, I've got the experience of this many, 90% got better. This is serious surgery, bad things could happen. And on the other side of it, you might be somebody that's disappointed. It's less guarantee than getting on a plane flying from Charleston to Atlanta. But have you ever asked the left seat pilot, who's usually the captain, on boarding the plane, ask him, You 100% guarantee that I'll get to Atlanta? What do you think that pilot's going to tell you? Well, I can't give you a 100% guarantee, but you know what? I'll 100% guarantee you that I'll do my best, right? And it works out. I've got a great team. I've got some mechanics down there checking out the engine. I've got some mechanics checking out the wheels. We've got everybody. You know how many people it takes to board a plane? It takes exactly 25 people, right? On the ground, just looking at all the stuff. So, but getting to the legal thing, no, I don't. Of course, when you practice medicine, you're always worried about legal implications. But I was always taught that if you're honest with the patient, and even the most well known things for a neurosurgeon, right? Like removing a herniated disc in your back. We know that if you remove that, the pain will get better. I've never told people that is 100% guarantee that it'll get better. Plus, I'm going to put you to sleep. You're going to be under anesthesia. Bad stuff can happen to you. You might die. You might wake up blind. You could have a hemorrhage. I could slice the nerve. You could have spinal fluid leaking. A lot of bad things could possibly happen. What do we want to do? If we tried everything else, if we tried physical therapy, if we tried injection, that kind of stuff. So I think a well-informed patient, and you won't be in trouble. It's almost always some poor or lack of honest conversations and communications with patients, right? And when you do that, I walk in with confidence, but then I leave them with that I'm also human. I'm very human, as is Jared. And we both make mistakes, and I can make mistakes. I'm not an angel from heaven. An angel's also known to make mistakes. We won't talk about that. But I'm definitely not the maker. And I'm as human as you are. When you're asleep and I'm doing surgery on you, I think of you as me, right? This could be me, or this could be my wife, or this could be my sister, or my relative. And I hope to be able to do really well for you, but it cannot be with a guarantee. And I think and look, I've gotten into trouble. I'll be honest, as a surgeon, I've gotten into trouble, sometimes to the extent that I'll look up at my assistant and say, who the hell consented this patient? Why did I get into this? Because it hurts, right? It hurts so these are risks, and we have to be honest with the patient. And when we're not honest with the patient about risks, and when bad things come out and tell them, you know what? It got messed up. I'm so sorry. Look in their eyes, hug them. I think if you do that, people will forgive. It's like taking your car to the mechanic and you go back and it's worse. And the poor guy comes in, sorry, man, I broke that axle. I apologize. It's awful. And you knew there was a risk, right?
Yeah.
So I think it's always discussing what you think it is. I'm almost confident that this is why it is. The surgery is risky. Most of the time it works out great. And when you develop that, and there are patients, they'll say, oh my gosh, I really don't want to take that risk. And they'll walk out. So we shake hands. We say, well, that's great. I feel good.
Yeah.
There are a few patients that say, no, I'm not that impaired. Can I come back see you in 6-12 months? I say, sure, 100%, So
yeah, we have heard that story about you in particular. We've interviewed a couple of people that they just weren't ready. Once they realized what really was going to happen, the kind of the scope of what brain surgery is, they decided they weren't quite that bad yet.
They appreciated the total honesty about I mean, it is brain surgery. It's the one surgery I think nobody wants to have. I don't think anybody's just going to jump into that and make that decision if they're having mild symptoms. I surely wouldn't have.
Yeah, we have to be
At
really
that point,
careful.
I was at the point where I truly did not want to continue living if I couldn't get some type of relief from what was happening. And so my decision was easy, but I had also been um, going on 3 years and just progressively getting worse. And I
Horrible.
was willing to take that risk at that point because I was, there comes a point where quality of life, I had none. I literally barely take care of myself.
Right.
When I say that y'all saved my life, that's not hyperbole. You did. I feel like myself again. I don't have delusions. You know, at the very beginning, y'all talked about that cluster of symptoms, the headaches, the cognitive stuff. So right at the beginning, that's kind of how mine started too. Headaches. My first cognitive thing, and I'll never forget it. I walked into our kitchen. There was a piece of fruit sitting on the counter. And, you know, I'm in my 40s. I should know what a banana is. And I could not tell you the name of the fruit. It looked alien,
Or
but
if
at
it
the
was
same
food.
time, it's like I knew I should know the name, couldn't figure it out. Took me a couple hours. Then I went, oh, that's a banana. That freaked me out. And this is before I had my first MRI. So this is when I kind of started going, well, maybe I should go see a doctor about these headaches and this cognitive thing. So,
Yeah, and I think those are the kind of things that I hear over and over again that just leads me to think that there's something the gland's producing that's affecting cognitive functions of the brain, whether it's the medial temporal lobe or the areas of the brain that make you remember, the hippocampal system and all that stuff, which is very close to where the gland is, and the gland probably is producing stuff that just blocks all of it. So the 45-year-old looks like a 95-year-old or a demented 85-year-old, and that sort of stuff.
For us, it was an absolute necessity. We knew that this had to happen. It was the only thing we had left. But I can't stress it enough. It's brain surgery. It's the last thing you want to have to do.
so
We've
I admire that as well.
we've said several times this is not a commercial for the Medical University of South Carolina because
Yeah.
we are kind of fans because it worked out so incredibly well for
For
us.
us.
But it was not easy. It was a long and difficult road to get to you. And then it was a more difficult road on the other side, but that one had a termination date, and it worked out very close to that. I mean, honestly, for a couple of months before October of last year, which was the 1 year mark, um, Kelly was back most of the time. It wasn't like the alarm went off when the 1 year mark came around and now it's gone. It was obviously on its way out for a long period of time, and there were weeks sometimes in between the episodes in those last few months. So, um, but it's a hell of a journey. And it's very, very difficult, but it is
Yeah, I think
for
I
us
think
absolutely worth it.
yeah, and I think it's important for patients to realize, and Jared can interject here because he gets to see a lot of patients in follow-up and stuff, that
Mhm.
the recovery can be quick, easy, but the recovery can be slow and just very nerve-wracking for family, the patient, him or herself, that why aren't we better? Why aren't we better? Why aren't we better? Et cetera, et cetera, et cetera. So sharing your experiences with other patients, very, very helpful. And then there are the few that can go beyond what Kelly took and will continuously, episodically, not as frequent as before, intense as before, continue to have symptoms. And I don't have an answer. It's all going to come from doing the right study and right
Mhm.
research to get this resolved. There is something here. Look, from my perspective, having the experience, there's something real going on here.
Right.
Absolutely. And Jared, as you think about that, if you don't mind adding to that, thinking about the patients that you've done intakes with, what are, without breaking confidentiality, obviously, some of the more dramatic changes that you've seen?
Well, in terms of good changes, right? or yeah,
Sure.
or either way.
I
Okay.
mean, again, we're just trying to be honest here. So,
Yeah. Well, I think I tell everybody before the surgery, I say, of the people that have not had those satisfactory results at a year, I can't tell them why.
Mhm.
I can't tell them what was different about them than the other person that did fantastic. The surgery is the same. Dr. Patel did a stellar job. The team did a great job. So what made them different? And I don't have an answer to that. I would say I love seeing when people go back to work. I think that to me is a huge win.
Mhm.
And I also, I try to talk to people in post-op and I try to beat them to it sometimes when they come into the office. I try to tell them what I expect them to feel before I let them tell me everything. Because the last thing I want them to feel is, hey, I walked in, I saw Jared, I told him for 15 minutes all these things I'm feeling, and he said, "Oh yeah, it's totally normal." I'm like, yeah, they'll feel dismissed, or they'll get in their car and they're like, "Is it normal? Did he listen to us?" And I found if I tell people, "Look, you're gonna have this kind of headache, and you're gonna have this sensitivity to light, and you're gonna feel physically and mentally overwhelmed by loud noises and all these situations," and it's so exciting for me because I'll look over and the patient will look at their family and they're like, right, right, that's it, or somebody will say that's exactly what their headache is like. That to me is a big win. As far as dramatic improvements, um, I I think I remember almost all our patients by name and I can see their face. I don't always remember the situations. Um, to speak to dramatic improvements, but I mean, I could just say that I've seen enough dramatic improvements and happy people to want to get up and do this again tomorrow. I think
Sure.
anybody that works in medicine um, goes to bed at night and wakes up the next morning wanting to help people. I mean, yeah, there's probably some bad actors there, but the vast majority of people in medicine really care about what they're doing.
Mhm.
And yeah, so I'm encouraged by experiencing this along with my patients. But as for big dramatic outcomes, I love seeing people get back to work. I love seeing people get back to their hobbies. I'm a musician, so being able to talk to people about getting back into music and just whatever made them feel alive and whatever brought them joy, and seeing them get to that point is so exciting for me. um yeah,
Yeah, that's awesome. That must be just awfully fulfilling. That's
I'm so
okay.
lucky.
Yeah, that's very cool. We've been fortunate in a couple of cases. In fact, we spoke with a 19-year-old young woman the day before her surgery with you, and then we spoke to her 3 days after, and she had the dark glasses and the ice packs and the not feeling just super great.
Mhm.
And we really wanted to get that, like this is not a cakewalk, and she and her parents were very gracious, and they wanted to do it also, and so we didn't push for this, but they wanted to do it, and that's great. So we have that boots on the ground. This sucks. This part is bad, and then we interviewed her a third time, 20 days later, and she had had just remarkable improvement, like things that she had had since she was a little girl. They believed that she had other issues and also this, and and at that point they were reassessing whether or not she ever had those other issues because they've all
Mm.
kind of started going away.
Yeah.
These things yeah, that they believe that she had had since she was a young child. Um, and
We've heard several stories of people with, X, Y, and Z, and they expected X and Y to go away, and then X, Y, and Z all went away, and so did Q, which they didn't even realize was in any way related. Um, I say that
because I say this because we've heard it several times. The statement that cystic enlargement of a pineal gland will not kill you. We've said that several times, but it is. I am absolutely convinced it is potentially a contributing factor. At one point, at 2, 3 o'clock in the morning, I had to have the police help me find my wife, who was walking barefoot and we don't know how many miles she walked, but her feet were completely torn up and bloody. And we found her 1.5 miles from our house, but how far she walked to get there, we don't know. Middle of the night. Other nights, plural, I had to get her out of our attic, where she was up there screaming for the children she believed that I had caged in our attic. And our attic is not safe. It is not a safe environment. And so while this thing in your brain may itself not sit there and explode or do something to kill you, I absolutely believe it can be a contributing factor. And we're starting to hear more of that now that our story is out.
Because those stories are incredibly embarrassing.
They're very embarrassing. Nobody
And-
wants to go say that stuff.
As bad as the physical pain was, that the mental anguish and watching what it does to your loved ones around you when you are in a lucid state in between episodes is, to me, was for me more horrific.
Sure.
So yeah.
So we've started something here to try to get this out, and I guess my next question for both of you is, and maybe Jared could start this one if you don't mind.
Sure.
When I am interviewing these folks that are post surgery, maybe so, maybe no, wherever they are, and folks all around the world, what is it you would like me to ask them?
My goodness. I'm not sure. I think something that I really enjoy asking people at usually the 3-month mark is, are you glad you had it done?
We always do.
Just big picture. Are you glad you had it done? And I learn a lot from just asking people their experience, to know that it's not a linear recovery, that it's variable. What would I have you ask?
I really put you on the spot there. Sorry about
You
that.
did.
No. It's a great question. I mean, I think it gets hard because, pre and post op, there's very little objective things that I can test or ask. So it becomes a very subjective, how was your experience? What is your life like now? I mean, I think if I could have any information, I would just want to hear from the people that are a year out of what could we have done different to prepare them, or what did they feel like was not discussed in depth in advance. I mean, I would any information I want is really, how can I do better on the front end
Perfect.
That's a
to
great,
prepare people.
yeah.
As far as after, and if they're happy, I'm happy. I don't have anything else otherwise.
Sorry.
Making note of
I
that.
just want to get that down so that it's right here for the next time that I
Yeah.
interview somebody that has been through it.
Well,
So we've talked about this thing from a lot of different angles, and we really greatly appreciate your time, and we don't want to keep you too much longer. But is there anything else that you think that the general public, because we've started to see the numbers on the podcast kind of go up, and there is some interest in it. Is there anything that we can do? Any place that we can point someone, any suggestions we can give to the general population of things that might be beneficial coming from this podcast?
I think just the podcast itself is an awareness that don't feel gaslighted by any physicians. They mean well, they just don't understand it. A lot of patients come in depressed or crying or whatever, and I'm like, all right, no single physician is going to know everything about everything, and not to feel depressed. This is talking to the people that have it, may have symptoms from it, etc. Just learn to get second opinions and things like that. I think regarding the other question you had, what else do you want people to know? And I think as you interview these patients, we want to get better. Jared's right. Just because we know how to do it and we've been doing it, we want to know from patients who've had their experiences with us, that post-operative period, how could we do better? And, sometimes information comes from I have learned that I learn more from patients than my colleagues sometimes.
Fair.
Because and so collectively learning from them, and so this is the other thing. And finally, the quest, right? I want people to know there's a quest by at least our team here, and hopefully some others in Europe or wherever they are, to really figure out why, right? The why is so important. Kelly, one day, years from now, or maybe she is now, in her quiet moment, maybe, why did this happen to me? Why did my gland enlarge? Why did my enlarged gland produce this? And so this is very important to me. And people need to know this. And so uh, I think it's important to ask people, have you ever wondered why this happened to you? I know you feel great. You're probably podcasting people that are feeling great. But did you ever figure out, wouldn't you want to know why this happened and how this happened? Because the ultimate goal of medicine is to prevent illness, right? Prevent hypertension, prevent heart attacks, prevent brain tumors, prevent pineal cysts from acting up and making a mess of your life, because it's a real mess. When Kelly was sick, it messed her up. She's in the attic. Now you're telling me she walked a mile. It messed you up, right? And it messed your child up. And all the friends and all the family is like, oh shit, we lost a human here, right?
Right.
And so there's got to be a question about early diagnosis. What kind of tests, what kind of research can we do? And maybe these people, do they ever wonder, and how can they help us, to figure it out? I'm not asking them to give me $1 million to do research, but just somehow the knowledge out there that this is an important question. Now, it's not as frequent as breast cancer. It's not as frequent as heart attacks. But you know what? To the individual who has it, this is huge.
Absolutely.
And as somebody who also had breast cancer in the middle of doing this, of course, we had to take care of that. But this was definitely worse than dealing with breast cancer.
The one that definitely will kill you was the least bad
Was
of
much
them.
easier. Yep. Even, I mean, I had to go through double mastectomy and everything. And this living through this was certainly harder. And the fact, I mean, I'm a degreed accountant. I work for the federal government. I thankfully am back to work now. But yeah, I mean, I full stop on life. And
Wonderful. I forget what you do, Kelly.
I actually work for the United States Census Bureau, and I do. A lot of people think that we only work the decennial, which the mandatory every 10 years, but we have for over 100 years several census and survey samples. And
when you hear the average income of a region and unemployment numbers, that's
right. So yeah,
cool.
so every month you'll hear, usually on the 6th or 7th of the month, when you do hear our unemployment rate change, that data came from the prior month. And it's a very fast-paced job. I really like it because we have, for example, for that specific one, for like the unemployment rate, we have 1 week to collect all the data across the whole United States, get it compiled. Then it has to be sent to the White House. It's got to be approved by the president for publication. And we have to do this every single month, and it has to be out usually by the 6th or 7th.
If you're communicating in the White House, just put in a little sentence at the bottom. Would you send money to the MUSC?
There you go. Yes, absolutely.
Yes. One exception to all his new procedures.
Just one. Just get this one done.
One of my first times that I thought, what is wrong with me? I was actually driving home from work, and I was driving home from a place that I was sampling. And I called my husband and I said, I think I'm like having I've never had a panic attack. I've never had depression or anxiety or anything like that. So I didn't know what any of that felt like. And I said, for some reason, I feel like I might be having a heart attack. Like my heart rate just went way up and I'm having trouble getting air. And I said, I'm just going to drive to the urgent care. Will you meet me there?
Oh my God.
And he was like, pull over.
we'll call those episodes from now on, and this is just going to be funny for you. We'll call it the pineal fart.
There you go.
Oh, that's good.
Love that. I am back to
Your
work
brain is
and
just your brain is just fine. It's just a pineal that was creating a mess. That's all.
yeah, I'm so happy and thankful to y'all. Incredibly happy now. And I used to have fear of flying. I've always been a nervous flyer. And after going through all this, I'm like, I'm not scared of anything anymore. That was what I went through with all of that. Bring it on, I don't
There you
care
go.
anymore. So
Right.
just thank you both so much
You're
for
welcome.
giving us your time, because you're going to help a lot of people make more sense of what they're also going through. We really, really appreciate it. We were super excited to do this, and I was happy to have another opportunity to thank you both so much from the bottom of my heart.
We appreciate you.
Yeah.
Thank you. Bye-bye.
Thanks so much, guys. Bye, y'all.
Bye-bye.
Thanks for listening to this episode of Pineal Stories, where patient voices matter and real stories have the power to drive change. If you or someone you love is living with a symptomatic pineal cyst, know that you are not alone. Our community is growing, and your experience matters. Share your story, connect with others, and help us push the medical conversation forward. Visit pinealstories.com to explore more stories, submit your own, and stay connected. And if you found this episode meaningful, please consider leaving a review and sharing it with someone who needs to hear it. Until next time, stay strong, stay informed, and keep speaking up. This is Michael Abels with my wife Kelly, and you've been listening to Pineal Stories. Thanks, y'all.